So first off, we're just going to tell everyone a little bit about the topic. So schizophrenia is a debilitating mental disorder and alters an individual's perception of the world around them. Symptoms have been identified to form 3 distinct clusters. Positive symptoms including hallucinations and delusions, negative including emotional blunting and social withdrawal, and cognitive dysfunction, which includes impaired executive functioning and working memory. Schizophrenia affects 40 million people worldwide. It is associated with considerable disability, poor educational outcomes, early death rates, and considerable stigma. These grim side effects and social considerations, as well as a $3.9 billion cost in Australia per year, has meant that research into this disease and its treatment is vital. In order to develop drugs to treat this debilitating illness, animal models are often used. These models either induce the disease or mimic aspects of its pathology to ascertain whether drug manipulations will be effective in treatment. Animal models are an essential part of the drug development process through adding to the understanding of schizophrenia's neuronal mechanisms and how it's ultimately treated. So the answer to this question is yes. These models are extremely important as a stepping stone in research in order for a drug treatment to be translated to humans, as well as being crucial in uncovering key markers which will further aid in drug development in future.
The specific models being used for the development of these drugs are pharmacological, which focus on neurotransmitter systems such as GABA, lesion models associated with altered structures in the brain, as well as developmental and genetic models, which focus more heavily on the development of the disorder. The ability of these models can be assessed by looking at behavioral phenotypic traits such as social withdrawal, as well as other traits, including increased dopamine release. The slide you can see here showcases a few specific models for inducing a schizophrenic phenotype and how they're assessed using cognitive and behavioral tests.
So the first point is that animal models are crucial for the drug development process, and this includes the development of drugs for treating schizophrenia. In researching human disease, animal models are a vital stepping stone and allow for better understanding of the disease process without the added risk of harming a human. Established and highly prestigious journal sources like Nature, Journal of Pharmacology, and even the FDA, as seen here, aim to educate the public on the need for animal research and feature many prominent research articles which utilize animal models. We can see just how essential these models have been by looking at history. It has contributed most of the basic knowledge in most scientific fields. Pretty much every drug treatment and cure for human disease was developed in part with the guidance of animal models. The sheer volume of animal model contribution can be seen by the near eradication of polio with the rhesus monkey, diphtheria using guinea pigs, as well as the development of organ transplantation, Drosophila work in mapping the genome, and the discovery of insulin for the treatment of diabetes type 1. Animal models have also been crucial so far in the treatment of schizophrenia, namely in the development of antipsychotics. These drugs were developed based on the dopamine hypothesis, whereby dopamine dysregulation resulted in positive symptoms like psychosis and stereotypies, as well as certain negative and cognitive symptoms. This enabled the development of antipsychotics in animal models, which act mainly via D2 receptor antagonism to reduce these positive symptoms. As can be seen in the figure, the use of amphetamine to induce dopamine dysregulation was treated with A, haloperidol, and B, clozapine, which reduced the positive symptoms of hyperactivity and stereotypies. Therefore, the importance of animal models for pharmacological treatment of schizophrenia has already been well established by the efficacy of antipsychotics.
Animal models can also be used to identify structural modifications of schizophrenia. These modifications can be exploited as a drug target and be used to develop drugs that treat negative and cognitive symptoms, which current antipsychotics are unable to target. For example, clozapine was able to effectively treat symptoms of hyperlocomotion, however observed no effect on deficits in social interaction. These models, specifically lesion and developmental models, will be discussed further below. To put it simply, lesion models study structural neural deficits that reflect the progression and symptoms of a disorder and allow us to target these deficits. In schizophrenia, a common lesion model is the neonatal ventral hippocampus lesion model, or the NVHL model. This brain region is known for its crucial role in regulating dopamine release. Models mirror the behavioral deficiencies that human schizophrenia patients display once they reach puberty. Furthermore, these models also display negative symptoms such as decreased social interactions and increased aggressive behavior in roughly the same timeline as their human counterparts as seen in this graph. From this, it was hypothesized that Postpubertal symptoms are due to the role of hormonal changes that occur during sexual maturation in hippocampal function. Developmental models, for example, the injection of methylazo-oxymethanol acetate, or MAM, during the fetal stages, as seen on the lower left graph, have successfully been used to induce positive symptoms, negative symptoms, as well as cognitive deficits, with reduced memory seen in the maze test. MAM inhibits the development of neuroblasts, the precursors to neurons, thus inhibiting growth of particular areas of the brain. This decreased growth in the hippocampus and other areas, as seen in the graph on the right, manifests as symptoms of hippocampal deficits relating to the specific pathology of schizophrenia itself. It must be noted, however, whilst current lesion and development models, as well as other models, such as genetic models, induce specific structural aspects of the disease, they do not holistically represent the disease. Hence, more research into animal models is needed to recreate the entirety of the disorder. What is unquestionable, however, is that animal models play a crucial role in understanding the underlying markers of schizophrenia, as well as giving an insight into the development of antipsychotics.
So the final point is that schizophrenic animal models mimic aspects of schizophrenia. This has enabled simpler drug development processes and increased human translation. Whilst these models do not represent schizophrenia exactly, complex human diseases can often be better understood in a simplified system where individual parts of the disease process are isolated and examined. The advantage of this is that simple drug treatment can be developed, with the results more likely to be valid across the species boundaries, as already seen with antipsychotics. Even if the disease cannot be mapped holistically in an animal, improving symptoms for schizophrenic patients is still better than nothing. Drugs which reverse or cure the disease are not the only way to improve quality of life of patients. Drugs that treat specific symptoms, i.e. the positive symptoms, are always welcome and needed. Several other diseases like diabetes type 2 and depression have also used this symptomatic approach to lead to increased quality of life. And as seen in the figure, antipsychotics have also led to an increase in patient quality of life. In addition, there are so many different types of animal models such as dopamine manipulation, anatomic or hippocampal dysregulation, and genetic manipulation of DISC1. Each model assesses or induces a different aspect of the disease. This has allowed for the potential development of new combinational pharmacological therapies which can treat not just the positive but also the negative and cognitive deficit symptoms. Combination therapy needs to be considered for those with treatment-resistant schizophrenia. So far, there have been trials that show combination of antipsychotics with antidepressants as an effective combination therapy option for schizophrenia when negative symptoms are reduced, as seen in the figure below. So overall, simple animal model paradigms have increased translation for human pharmacological treatment options. The variety of these approaches could potentially be used in combination for a more holistic treatment.
And yeah, just to reiterate our findings, animal models were key for the discovery of current treatment of schizophrenia and are still needed to develop key indicators that represent susceptibility towards it. We found that although there are problems with certain research paradigms, the need for animal models cannot be understated. They are a key stepping stone for novel drugs.